Miss Ravenswood.
Hi.
Hi, I'm Julie Brown. I'm a student nurse midwife.
Nice to meet you.
It's nice to meet you as well. Are you familiar with a nurse midwife?
Yeah, sort of.
Okay. So just to let you know, a nurse midwife is an advanced practice nurse who provides care throughout the lifetime for women, including assessing, diagnosing, and treating medical concerns, as well as providing pregnancy, birth, and postpartum care. So.
Great.
And what did you want me to refer to you as?
Oh, you can call me Grace.
Grace, okay. Nice to meet you, Grace. And can you just confirm your birthday for me?
Yeah, it's October 11th, 1979.
Okay, perfect. And is this your first time here in our office?
It is.
Okay. And who do you usually see for?
I usually go to the Evanston clinic, but my insurance changed.
Okay. And are they your primary care providers?
Yeah.
Okay. Perfect. And what are you here today for?
Just a wellness checkup.
Wellness check. Okay. And when was your last exam?
About a year ago.
Okay. And what was the reason for that?
Just wellness.
Okay. Do you have any significant past or present illnesses, including mental health illnesses?
Nope.
No? Okay. Anything, any concerns related to your health?
No concerns.
No concerns? Okay. So I'm going to be going through and just kind of getting a general health history from you. I will be asking some personal questions, but everything I ask today is confidential.
Okay.
Okay? What is your immunization status? Are you up to date?
I'm up to date.
Okay. When was the last time you got the tetanus?
2 years ago.
Okay. And how about the last time you got a tuberculosis test?
Last year.
Last year. Okay. Do you get the flu shot?
I do. I haven't gotten it yet this season.
Okay, but you have in previous seasons. Okay. That'll be starting pretty soon. That'll be coming out. So. And how about the hepatitis B vaccine?
Yeah.
You've had that? Okay. And not the pneumonia vaccine as well, right?
No.
Okay. And any recent exposure to communicable diseases such as tuberculosis, hepatitis B?
Nope.
No. Okay. Do you have any allergies? Any seasonal, environmental, food, or drug allergies?
No food or drugs. I guess seasonal allergies.
Okay. And how about penicillin or latex? Any allergies to either of those?
Nope.
No? Okay. Any hospitalizations or surgeries?
I had my wisdom teeth out in 96.
Okay.
And then my tonsils out in 1997.
Okay.
And I guess I had a birth in a hospital.
Okay. And what year was that?
That was 2007.
Okay. Perfect. Any injuries or accidents?
Nope.
No. Any harmful ingestions, like any poisons or anything like that you've ingested? No. Okay. And any medications that you're currently taking? Both prescription or no prescription?
I take ibuprofen sometimes
Okay.
for headaches, and Flonase for my allergies, just
Okay.
occasionally when they're bugging me.
Okay.
I take vitamin D and magnesium,
Okay.
and I have a Mirena IUD.
Okay. Any other supplements, vitamins, home or herbal remedies?
No.
Do you seek any kind of complementary or alternative therapies like chiropractic, acupuncture?
Oh, chiropractic sometimes.
Okay. And do you follow any kind of a special diet?
No.
Okay. And what do you seek the chiropractic care for?
Just for general wellness.
General
just
wellness.
body
Okay.
getting in alignment.
Okay. Now I just need to ask a little bit about your family medical history.
Okay.
I want you to go back as far as your grandparents and include your children in this. We also, I also want to take in, your aunts and uncles as well, if there's any kind of medical concerns with any of them. Anything off the bat that you can think of that you want? Okay. Does anybody have any allergies or asthma?
My son's allergic to amoxicillin.
Okay. And any high blood pressure or heart disease?
No, my paternal grandfather died of a heart attack when he was 72.
Okay. Was that his first heart attack?
No, I think it was his second.
Okay. When was his first heart attack? Do you know how old he was?
Like 65.
Any other heart disease in the family?
No.
Any strokes?
Nope.
No. Any diabetes?
Nope.
Cancers?
My uncle died of multiple myeloma.
Okay. And was that an uncle on your?
My dad's brother.
Your dad's brother. Okay.
I think he was 61 when he died.
61. Okay. Do you know how old he was when he was diagnosed?
Probably 59.
Okay. Anybody else have any cancers?
No.
Any thyroid disease?
Nope.
Any blood disorders?
No.
Obesity?
Nope.
Vision or hearing problems?
My maternal grandmother
Okay.
had hearing aids.
Okay. Was that in older age or did she have those all along?
Yeah, no, probably in her 70s.
Okay. Okay. And any genetic or congenital diseases?
My cousin has Down syndrome,
Okay.
but she's doing great. She's 40 and
Okay. What side of the family is that on?
my dad's side.
Okay. Okay. And any neurological problems, seizures,
No.
any emotional concerns, depression, anxiety, anything like that?
Nope.
Other than the one cousin with Down syndrome, any other family members with any form of mental retardation? No. Any drug or alcohol abuse?
Well, my maternal grandparents drank a lot of alcohol. I don't think that anybody ever called it alcohol abuse, but my grandmother died from alcohol-induced dementia, and then my grandfather died from alcohol-induced pancreatitis.
Okay. And how old were both of them when they died?
In their 80s.
Okay. 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 Any other alcohol or drug abuse in the family? No. Okay. And other than your maternal grandparents and your paternal grandfather, any other deaths in your family? Any
My
aunts or uncles or grandparents?
paternal grandmother
Uh-huh.
is doing great. She's 97.
Okay.
And her knee hurts, but she's great.
That's fantastic.
And yeah, my uncle died of cancer. Everybody else is still alive.
Okay. Okay. And I know you have the one son that has the allergy to amoxicillin. How many other children do you have?
Just one more, a
Okay.
daughter.
Okay.
No health problems.
No health problems with her. Okay. And how about siblings?
I have one biological sister.
Okay. And any health problems with her?
She had gestational diabetes in her second pregnancy.
Okay. Are you concerned about any illnesses of a family nature or genetic?
No.
Okay. Okay. And who do you live with?
My husband
Okay.
and my 2 kids.
Okay. And how old are your kids?
They're 6 and 9.
Okay. And so you are married?
I am.
Okay. And do you currently work?
I do.
Okay. What's your present occupation? What do you do?
I'm a nurse.
Nurse? Okay. And is that your usual occupation?
It is.
Okay. How long have you been a nurse for?
2 years.
Okay. Okay. In terms of have you had any job changes that were required due to health problems?
No.
No. What were you before you were a nurse? What did you do?
I was a stay-at-home mom.
Okay. Do you have any occupational health risks? Exposure to chemicals, fall risks, risk for injury, any exposure to violence in your job?
No.
No. Okay. Do you have any concerns related to your financial status?
No.
Do you have health insurance that covers both primary and inpatient care?
Yes.
Okay. And what is the highest level of education that you've completed?
I've got a bachelor's degree.
Okay. And how much alcohol do you consume?
Usually like a glass of red wine with dinner a couple times a week.
Okay.
2 times a week.
Okay. Is this the same or different than in the past?
About the same.
Okay. Have you ever been a smoker?
No.
No. Any use of tobacco products?
No.
No. How much caffeine do you consume? Including coffee, caffeinated teas, energy drinks, soda?
I drink a lot of coffee,
Okay.
probably like 3 to 4 cups a day.
Okay.
No soda, no energy drinks. I just drink coffee and water and occasional glass of wine.
Okay. Okay. Any other drug use, including marijuana?
No.
Okay. And what is your sleep like?
Well, I work nights, so it's pretty choppy, I guess.
Okay.
On the nights when I have to work, I try and catch up during the day, but
Okay.
I get like on the nights when I'm not working, I get like 5 or 6 hours a night, and then um, when I'm working, I try to get 6 hours a day.
Okay. Okay. And when you do have the opportunity to sleep, are you able to fall asleep easily? Is your sleep disturbed at all?
No, it's pretty good.
Okay. And what do you do for exercise?
I try and walk
Okay.
like every day about 20 minutes, and then I have some exercise videos that I do at home
Okay.
a couple times a week, hopefully.
Okay. And any other hobbies that you have? Leisure activities?
I like to read. I like to go to the beach.
As far as your diet is concerned, what have you eaten and drank in the past 24 hours?
Let's see. Yesterday for breakfast, I had coffee and a banana and a hard-boiled egg.
Okay.
And then for lunch, I had yogurt and a peach.
Okay.
And then for dinner, we had burgers and a salad and sauteed Brussels sprouts.
Any snacks or anything?
I had a cookie after dinner.
Okay. And how much do you drink per day?
Of
And
what?
what do you drink per day?
Oh.
During the day. I know you said coffee and
Yeah,
water
I drink
mostly.
coffee
so.
and water.
Okay.
I
About
drink
how
a
much
lot of
water?
water.
Okay, you drink.
Yeah, like, I don't know, 8 to 10 glasses
Okay.
minimum.
How many restaurant meals do you eat per week?
Oh, not that many. I mean, maybe one.
Okay. And any special dietary practices?
Nope.
No. Okay. How would you rate your overall stress level?
Moderate.
Okay. And where does your stress usually come from?
Having 2 kids and working, and
Okay.
we just started the school year, so we're getting them back in a routine, and that's stressful.
Yeah,
Just getting
it's always a hectic time.
Yeah.
And what do you do to help you cope with stress?
Exercise, deep breathing.
Okay. How do you feel like that works for you?
I think it's fine.
So you feel like you're coping okay with
Mhm.
your stress level? Have you or any of your family or friends witnessed or been exposed to any violence or abuse?
No.
No. Okay. Do you wear seatbelts routinely?
Yes.
Okay. And when riding a bike, do you wear a helmet?
Yes.
Okay. Do you have smoke and carbon monoxide detectors in your home?
We do. We just replaced them last year.
Okay, perfect. And do you have any guns in your home?
No.
Have you been exposed to any health hazards in your environment? Any crime, pollution, violence?
I mean, probably pollution. I live in the city of Chicago,
Okay.
but
Yeah.
nothing particular.
Okay. How about any secondhand smoke exposure?
No.
Any lead or radon exposure that you know?
Not that I know of.
Okay. And what water source do you have?
The city of Chicago, tap water.
Okay. Do you have any special religious affiliations? Okay. So nothing in terms of your faith that would affect your health care?
Nope.
No. What's your current weight?
About 140.
Okay. And is that the same or has it changed recently?
That's the same.
Okay.
Been that forever.
And are you happy with that weight or would you like it to change?
No, that's fine.
Okay. Have you experienced any fever, chills, just general tiredness, fatigue, night sweats, anything like that recently?
Not recently.
Okay. Okay. And are you experiencing any pain today?
None.
None. Did you have any concerns regarding the condition of your skin, like any dryness, any skin diseases or problems, psoriasis, eczema, anything like that?
No, I mean, I think my skin's on the dry side, but I just use lotion and that's fine.
Okay, and that remedies it.
Mhm.
Okay. Have you had any changes in your skin?
None.
Do you have any moles?
Yeah.
Any changes in those?
No.
Do you see a dermatologist regularly?
Yeah, I do.
Okay. And any changes with your nails? Any concerns or
Nope.
issues with them? Okay. How often do you use sunscreen?
Daily. It's in my moisturizer.
Any changes in terms of your hair quality? Any hair loss? Anything else?
Nope, not that I've noticed.
Any? Are you concerned at all about the condition of your scalp? Any changes with your scalp?
No.
Okay. And I see that you wear glasses.
I do.
Okay.
I
And
have an astigmatism.
in astigmatism. Okay. And when was your last eye exam?
8 months ago.
Okay. Any eye problems?
Nope.
Do you have glaucoma or cataracts? Okay. Have you experienced any hearing loss? No. Any pain or discharge from your ears?
Nope.
No. Any ringing in your ears?
No.
Vertigo or dizziness?
No.
No. Do you wear hearing aids?
I don't.
Okay. Have you had frequent colds or runny noses?
No.
Any sinus pain or infection? Any nosebleeds?
No.
No. Okay. How often do you brush your teeth?
Twice a day.
Okay. How about floss?
Maybe every other day.
Okay. When was your last dental exam?
I know I'm due for another one pretty soon, so it was probably about 6 months ago.
Okay. And any missing teeth or dental problems?
Nope.
No. Have you noticed any stiffness or swelling in your neck?
Nope.
No. Any lumps or tenderness in your neck?
No.
Okay. Do you perform breast self-exams?
Yeah.
Okay. How often?
About every month.
Okay. And have you noticed any lumps or soreness in your breast?
No.
Any nipple discharge?
Nope.
No. Have you ever had a mammogram?
No.
Okay. As far as your respiratory system is concerned, any issues, any cough, mucus production, shortness of breath, wheezing?
Nope.
No. Any history of asthma?
No.
And have you ever had any chest pain? High blood pressure?
Nope.
No. Any heart murmurs?
No.
Yes. Any history of high cholesterol?
No.
No. Okay. As far as your GI system is concerned, what are your bowel patterns like?
Oh, I usually go every day or every other day.
Okay. Do you ever have to strain to use the bathroom?
Sometimes. But that's what I take the magnesium for.
Okay.
seems
And
to
that
help.
takes care of it.
Mhm.
Okay. Perfect. Any diarrhea, constipation?
No.
No. Any nausea or vomiting?
Nope.
Any rectal bleeding?
No.
Any swelling in the glands around your groin? You feel little bumps? Or,
No.
Okay. Any food intolerances?
None.
Any changes in terms of your urinary frequency?
No.
No. Do you feel like you go to the bathroom too often?
Nope.
No. Any painful urination? Blood in urine? Any leaking of urine? No. Any flank pain that would kind of be in mid, back, over on the side here?
No.
No. Have you ever had a UTI, a urinary tract infection?
I did. I had one when I was 19. It was awful. I haven't had one since.
None since? Okay. Any history of any sexually transmitted infections?
No.
Any unusual vaginal discharge?
No.
Okay. And what was the first day of your last period?
I don't really get periods on the Mirena.
On the Mirena. Okay. Okay. No spotting or anything?
No,
No.
not usually.
Okay. And how old were you when you first got your period?
14.
Okay. Prior to being on the Mirena, were your periods regular?
No, they were irregular.
Okay.
Pretty heavy bleeding. That's kind of why I got on it.
Okay. But you were seeing somebody for gynecological care,
Yes.
and you knew that wasn't of any concern.
Yep.
They investigated that. Okay, good. Did you have any cramping or premenstrual symptoms?
Not really.
Okay, and how many pregnancies have you had in total?
Just 2.
Just 2. Okay. And you have those 2 children.
Mm-hmm.
What were their birth dates?
July of 2007,
Okay.
2007, and then August of 2010.
Okay. And were they vaginal or cesarean births?
Both vaginal.
Birth vaginal. Okay. And any complications?
Nope.
Okay. And you didn't have any abortions or miscarriages?
No.
Okay. Any postpartum depression following either your childbirth? Do you have any issues or concerns with your fertility?
None.
And I know you're using the Mirena right now. Any other contraception that you use?
Nope.
No. Okay. And are you happy with the Mirena?
Yeah.
And when was your last PAP?
2 years ago.
Okay. Have you ever had an abnormal PAP? No. Now, do you have sex with men, women, or both?
Just men.
Okay.
Just my husband right now.
Okay, so just one partner right now.
Yeah.
And how many partners have you had in your lifetime?
6.
And what forms of contraception have you used through your lifetime?
Condoms. I was on ortho-tricycline for a number of years, and that was fine. I tried the mini pill, and that didn't really work for me.
Okay. So to move on to your musculoskeletal system and kind of movement, etc. Any limitations in terms of range of motion and movements?
Nope.
No. Any swelling in your joints or anywhere else, or any weakness?
No.
Any pain or stiffness in your joints or back?
I have nothing that a little stretching doesn't help.
Okay. And that's back pain or joint pain?
Yeah, when you
Okay.
wake up in the morning or when I've been sitting for too long.
Okay. Any impairment in terms of your gait and how you walk and are able to hold yourself?
No.
Okay. Do you have any history of head injury?
No.
Any history of loss of consciousness? Any loss of coordination?
Nope.
How about any dizziness, numbness, tingling, tremors? No. Have you ever had a seizure?
No.
How about headaches? Do you get headaches?
Yeah, I get headaches.
Okay. About how often?
I don't know, like once a week.
And any changes in vision with the headaches?
No.
Any nausea or vomiting?
No.
Have you ever had any migraines?
They're strong. Sometimes they're strong headaches, but
Okay.
I don't know if I'd call them a migraine.
Okay. And what do you usually take for the headaches?
Just some ibuprofen.
Okay. And does that take care of them?
Yeah.
Okay. Do you have any impairment in terms of cognitive functioning? And
I don't think so.
okay. Okay. Any memory problems or just okay? Okay. And any irritability or mood swings?
If I get stressed out but no, nothing.
Nothing that you're concerned
Yeah.
about. Okay.
Nothing regular.
Okay. Have you ever had any anemia?
You know what I did as a teenager?
Okay. Any anemia since then? No. Okay. Any bleeding tendencies? No. Any history of blood transfusion? No. Have you ever had any thyroid problems?
Nope.
Any unusual sensitivity to hot or cold environments?
Nope.
Any excessive thirst or hunger or appetite?
Nope.
No. Okay. How would you describe your general mood?
Oh, I think it's pretty good.
Okay. Do you have any past or present mental health concerns, anxiety, depression, panic?
No.
Said slight mood swings, but nothing you're concerned about.
No.
Okay. Any hallucinations?
No.
Any eating disorder? Any history of eating disorder?
No.
Okay. And have you ever thought about or attempted suicide?
No.
No. Have you ever been treated for any mental health concerns? No. Okay. So I have most of the information I need. Do you have anything else that you're concerned about with your health?